Hi beautiful people, you're welcome once again. This is Nurse Ika show, and of course I am Nurse Ika, your favorite nurse. Today we are bringing you the part 2 of the video on how to assess and properly manage an unconscious victim. So today, just stay tuned and see. Remember, we already looked at the Dr. ABC of how to manage an unconscious victim, and we looked at DR, which is D for danger, R for response. We looked at A for the airways, we looked at B for breathing, and today, beautiful people, we are going to be looking at C, which is the cardiopulmonary resuscitation. Therefore, you want to stay tuned so that you will not miss on this very wonderful episode. Okay, so now remember, we have looked at A, we have looked at B, we have looked at DRO and everything, following the normal steps, the DRO, A, B, C. Now, assuming our victim is not breathing normally, remember that after you have checked the airways and the breathing, we have all agreed that if the patient is gasping, we are not going to consider that as breathing. If the person is not actually having a normal breathing pattern, it will be considered as not breathing. Now, this is the part where you make the most important decision whether or not to start cardiopulmonary resuscitation. In this case, my person or my victim is not breathing, and I have decided to start performing cardiopulmonary resuscitation. How do I do that? The first thing is I kneel beside the unconscious person. You have to kneel beside the unconscious patient, and then you place your first hand at the breastbone of the person, in between the two breasts. That's the breastbone. You place the first hand, and then the second hand you put it directly on top of the first hand, just as you see my fingers. Then now you have to be straight, like 90 degrees in front of your unconscious victim, and then you have to give a push down into the heart. You are not trying to support yourself into the victim's body, but you're giving a push down, and that push should be at least 2 to 5 centimeters. And when you give that push, you allow your hand to come back up. That is giving the lung enough time to recoil. So this is what you do. You do that. You give 30 chest compressions. They are called chest compressions. So when you give your victim 30 chest compressions, the next thing you want to do is to give the victim 2 live breaths. But not everybody is trained to give live breaths. So if you're unable to give live breaths, all you need to do is to continue giving 30 chest compression. I want you to pay attention to the way my arms are. You realize that they are 90 degrees to my chest. So and your elbow is not moving. The only function here is your wrist. Your wrist is the only part being that job. Elbows are not supposed to move. So you're 90 degrees and you're giving the chest compressions 30, while giving some time. As you come back up, you're giving some time for the chest to recoil. You get? So if you're unable to perform, to give the rescue breaths, that shouldn't be a problem. All you need to do is to give these chest compressions. And studies have shown that the quality of the chest compressions reduce with time. Therefore, if you're 2 of you, you can give chest compressions for 1 to 2 minutes, and then you exchange with your friend. You understand? However, if there is nobody, you keep giving the chest compressions and observe if there are any signs of life. Sometimes when you give people chest compressions, they will throw up. And once they are throwing up, you quickly turn them to the side, or you turn the head so that they can send out whatever is in the mouth, so that the vomit doesn't choke them and the situation becomes worse. So if you're giving chest compressions, you're vigilant. You're observing. As you're giving chest compressions, once the victim wants to vomit, you quickly turn it so that every vomitus can come out from the mouth. Now, you would ask me, when then do we stop giving these chest compressions? When you're tired, you stop. If help arrives, remember that before you started everything, you had called for help. So if help arrives, you can stop the chest compressions. If the emergency team asks you to stop, then you will stop giving the chest compressions. Or if you realize that you are in danger, or the victim is in danger, the environment is no longer safe for you, then you have to stop performing these chest compressions. Thank you very much. I hope you learned something in this video, and please don't forget to subscribe to our YouTube channel and to turn on your notification bell so that whenever we have new videos, you will be informed. Thank you. I remain your favorite host, Ms. Ika. Bye bye.